Welcome to the Royal Aberdeen Children's Hospital. Where every year...
Option number one is chop it off.
more than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie City and Casualty and what you actually see in the soaps.
Coming up, Jason suffers serious injuries after crashing his quad bike.
If we were to touch him without adequate pain relief, he would be in a lot of pain.
A dangerous condition leaves baby Helena struggling to breathe.
Listen how noisy, because she's so desperate for us.
And we get the tips of the trade from the hospital painters.
Thank you, Jim. I suppose I do my job.
This is the Children's Hospital. The emergency department at the Royal Aberdeen Children's Hospital operates 24 hours a day and treats around 17,000 patients each year. Those with the most serious injuries receive urgent care in the department's resuscitation room.
When a child comes into resus, our first priority is to do what we something call a primary survey, because in a primary survey we're trying to identify things that actually can be life or limb-threatening.
14-year-old Jason and his mum have just arrived.
Do you feel the part of the body that you've broken?
Yeah, it's definitely
It looks like it's your thigh bone. Yeah.
Which was that bone?
Yeah, that bone there. It's a big bone.
The thigh bone, or femur, is the largest bone in the body, and a suspected fracture is causing Jason severe pain. He was thrown off his quad bike after crashing into a barbed wire fence and landing in a field.
He wasn't crying or outwardly showing any emotion when I did find him, because he just said, "I've broken my leg." And there was no drama with Jason at all.
Okay, I'll just keep up twitching.
Yeah, it's all the muscle spasm.
Emergency medicine consultant Dr. Lee is coordinating Jason's care.
A fractured femur is actually a very painful injury. If we were to touch him without adequate pain relief, he would be in a lot of pain. So the plan is, I'm going to give him just a small dose of ketamine just to allow the pain. Might be a small risk that you might have some hallucinations when you later on. But don't worry about it, yeah? Yeah, you feel that now, eh?
I feel good.
Comfy?
A portable X-ray is brought in to assess Jason's injuries. Orthopaedic registrar Mr. Whitaker checks the results.
So he's got a mid-shaft distal femur fracture. You can see it's quite overlapped. So the plan now is first aid first. So we'll put him some traction for pain.
Applying a traction splint will help stabilise the fracture, but it's a potentially excruciating procedure. Jason will need stronger pain relief.
Hands ready, Daddy, got them for me. Good lad. Feasting.
Emergency medicine registrar Ben and nurse Lauren perform a nerve block.
Just feel pushing though, not sure. Relax.
An ultrasound scan helps guide them to the correct nerve, where a local anaesthetic is injected.
For perpendicular, just go straight down.
This will remove all feeling in Jason's leg.
Okay, and inject, right, 2 mils.
There should be no resistance, yeah?
No, there isn't.
Good. Jason, are you feeling anything? Any improvement?
My leg doesn't feel as bad, but it's still
Yeah.
While the team waits for the nerve block to take hold, Mr. Whitaker prepares the splint.
This is a splint that was invented
in World War I, they found that army patients who had open femur fractures, the mortality rate was about 80% in the field. When they introduced the Thomas splint, which is a simple mechanism of holding the bones still and reduces the amount of volume in the thigh, so it reduces bleeding, the mortality rate dropped by half. So it revolutionised just field trauma, and we're still using it.
You're going to breathe with me. Deep breaths in and out, nice and slow. That's it. And relax. And that's it. Be all right. Deep breaths now. Okay, and relax your leg. That's it. Good man. That's it.
1, 2.
Oh well, the block's definitely working if you can lift it that high. So. Yeah. Jason, wiggle your toes for me.
The splint is a temporary fix. Jason's stay in hospital is far from over.
There are options in children to do non-operative management, which would involve using the traction system for at least 6 to 8 weeks. But Jason's a big boy and he's fit and active, and I don't think he'd take too kindly to sitting in bed for 8 weeks.
Jason will have surgery tomorrow.
I love you in the morning and in the afternoon.
There's another new arrival in the high dependency unit.
I love you in the evening.
14-month-old Helena was born with a cleft palate. She had successful surgery for that a week ago.
I love you.
But since then, Helena has developed sleep apnea,
Should we put you in your cot?
a distressing and potentially dangerous condition.
Because her chin is too small, her airway is quite tight. So when she was born, she had quite a few problems.
Respiratory paediatrician Dr. Osman is looking after Helena.
It was apparent that she does have some ongoing, what we call obstructive sleep apnea. That means that she has got breathing difficulties. When she goes to sleep, the airway is floppy. Now, in all of us, it can be sort of relaxed. But we manage somehow to keep our airway open.
We brought this video to show it to the consultants here. Listen how noisy, because she's so desperate for us.
In severe cases, sleep apnea can lead to issues with growth, learning, and even heart problems. Dr. Osman is going to try and address Helena's condition with a continuous positive airway pressure machine, or CPAP.
It's connected to a mask that goes on her face, and that gently blows air that essentially keeps her airways open.
The mask can't be fitted until Helena is fast asleep.
So just lift her head up, just slightly.
No.
If you hold that on there for just a second. That's us. Get on it, open.
I'm sorry. Come on.
The mask is a step too far.
Initially, when it goes on, if she's not in a deep sleep, it will feel a bit funny. Because if you imagine, like, sometimes if you stick your head out of a car window, it's a big whoosh for her. So if she's not in a complete deep sleep, she will just wake up.
Success.
It's over to Dad to try to get Helena to sleep.
She's still playing around. And we thought it was going to be challenging, but we never thought it was going to be this difficult. Fingers crossed she picks it up and she will be able to breathe.
At last, Helena nods off. And the nurses can try fitting the CPAP mask again.
It's okay, baby.
The team are still struggling.
Shall we try it again?
Yeah.
This time, they try a new approach with Helena awake.
Want to try?
Helena's turn.
No.
Okay.
Helena's turn.
Yeah.
Almost done, yes. Good girl, oh well done.
Yes, you're feeling it now.
Finally, after more than 3 hours of effort, Helena begins to settle. It's the morning after.
Hello there. How are you doing?
She did very well, I think.
Did she?
Yes. Once she kind of started to settle in and she started to realize that, I can breathe.
Yeah.
Then she kind of relaxed and she drifted to sleep.
Helena eventually kept the CPAP mask on for 5 hours.
You've done a superb job. We would consider anything above 4 hours actually to be a success.
Yes. We're not there yet, but we will get there.
We will get there.
Helena will stay in hospital until she gets used to her new sleeping routine. If all goes well, she and her CPAP machine will be able to go home.
Bye.
Bye.
I'm delighted. I'm really happy with the progress. It's been a really marked difference.
And now we can take a nap.
Carry the one on there. 19 at 4.
Wow.
8-year-old Amelia is missing school while she spends 2 weeks in hospital.
There, that's kind of big, so. This is from the school and stuff, so everyone's put their name in it and nice comments. To Amelia, we miss you very much and can't wait to have you back in class. And then it says Mrs. H for Mrs. Higgins.
Amelia was born with cystic fibrosis, an incurable genetic condition.
Is when you get like quite a lot of mucus in your lungs, so you try to cough it out by doing physio. If you get like bugs or chest infections growing in your lungs, then it makes you unwell.
Cystic fibrosis patients are vulnerable to infections, and Amelia needs help fighting the bugs currently growing in her lungs.
Tomorrow morning, I have to be up at like maybe
Very early.
very early because I'm going to theatre first thing for a new PICC line because my other one got clotted with the blood from physio. I think it was when I was doing like star jumps and things, so it kind of hurt.
And what is your PICC line?
It goes in like maybe about here.
And under your skin.
And then in under my skin down to my chest.
Up here.
Yeah.
Down here.
Yeah.
And what goes in the PICC line?
Antibiotics, like IVs and stuff.
Your
like
IV
that.
antibiotics.
Yeah.
So it's fast acting too. Clear any bugs, isn't it?
Yes.
Hello.
Hello.
Can I come in?
Yes.
So, is your name Amelia?
Yeah.
And are you...
Consultant paediatric anaesthetist Kay is responsible for fitting Amelia's PICC line.
Sometimes they are really fiddly to do because the veins can be quite small in children, particularly if they've had lots of venous access attempts in the past. The other thing is, where are we going to put it? So where did they try before?
They tried here,
Yeah.
but the problem is I'm left-handed.
Okay, that's useful information. I'm going to write that down. What about your...
Amelia will have her PICC line inserted tomorrow.
Bye.
14-year-old Jason has spent an uncomfortable night in hospital after breaking his femur.
Probably slept for like 3 or 4 hours. Trying to turn up my side and just pulled my leg, and then I had to get more medication because it was just agony.
Good morning. It's Jason, is that right?
Oh, Mum.
Hi. Hello.
Orthopaedic surgeon Miss Mills comes to see Jason.
So how did you do this?
Went on the ward. I went over ice and with friends.
You certainly did. So we need to operate on your leg to fix it. Okay. We can't leave you like this. The plan is we'll plate it. It'll mean we have to open up your leg and your thigh, probably about that long, and line the two bone ends up and put a plate on his feet. Once we've plated it, we'll be able to get up crutches and put a bit of weight through the leg, and it still will take 2 or 3 months to fully heal, but it'll be held on the inside.
Jason goes to theatre.
Oh, hello.
Very nervous now.
For Jason's mum, it will be a long and difficult wait.
Just about 2 years ago now that my husband was diagnosed with cancer. And then sadly passed away just 3 months later. So there's a lot of the hospital I know very well, been here a lot. There's a lot of flashbacks. The drive in, parking, walking the corridors where I pushed him round in his wheelchair and things. Waiting for more bad news on top of more bad news. So probably, as you say, when Jason went into theatre, I didn't allow myself to think anything but he was going to be fine. Because all my husband's news was bad news.
Hundreds of staff make sure the children get the very best of care. But unseen by most, there's a small army of workers making sure the hospital is kept in tip-top condition.
Put it in the back.
Put it in the back, yeah.
Hospital painters Jim and Murray are on the medical ward.
Here we are, Jim's room we're doing today.
That's it, magic.
Painting a hospital isn't like painting your house.
This is our top mat. You peel it off. And now you've got a sticky surface. So if there's any dust in here, when you leave the room, dust on your shoes will be on the top mat and doesn't go down the corridor. So it's just containing infection in here, any dust.
I'm basically sanding down the wall. Obviously we're working in a hospital, we're not allowed to rub down with sandpaper, so we do with a cloth, damp cloth, so we're not creating any dust. So we just give it a spongy over.
It takes hundreds of tins of paint each year to keep the hospital looking fresh.
Hope you like the colour, Jim.
Colour have you choose for this room, Murray?
It's a nice shade of cream.
50 shades.
That's grey, mate.
Like my hair.
Well, at least you've got some hair.
True story.
We use water-based paints in the hospital, mainly because drying purposes, smell of paint, odour, so it lets us get our job done quicker.
It's a technical bit cutting in.
Jim and Murray have worked together for 2 years.
I do look younger, even though I've got a wee bit of hairstyle problem, but no. Folk think I look younger than Jim, but I'll leave that at the moment.
He's been here since the NHS started, 71 years ago.
And there's never a dull moment.
And he's a Ross County fan.
Oh,
shocking.
Someone's got to be like that.
Jim and Murray work across the entire Aberdeen Hospital campus, and their job is never ending.
It's like the 4th rail bridge. I mean, we could paint this room today, come back on Monday, and it could be all damaged. Once they put beds in and furniture in, and it could be marked. So we've always got something to do. You rolling, or you want me to do it? Feel like you're for missing bits. So there you go.
Yes, thank you, Jim. That's why it's a two-man job.
I've also got a step counter on my phone. It's roughly about 4 miles to 5 miles a day we'll walk. Right, we'll go for a cup of tea, will we?
That's a good idea, Jim.
Good idea, let it dry. Your turn to mark tea. Let's go.
Okay, let's go, Jim.
It's 8 a.m. and cystic fibrosis patient Emilia is about to head to theatre.
Today I'm going down to theatre to get another PICC line because my other one had clotted with blood.
A PICC line is a long, flexible tube which will deliver antibiotics to Emilia's veins, helping her fight off infections. Consultant paediatric anaesthetist Kay briefs the team.
So what I'm going to do is just have a look with ultrasound first to see where the best veins are.
Ultrasound uses high-frequency sound waves to capture live images from inside the body.
Right, there's an artery there. You can see there's a nice vein there, and next to it there's an artery that's pulsating. Right.
Kay locates a suitable blood vessel and fits a cannula.
Put it in the middle. Right.
She can now begin inserting the PICC line.
So this should feed really nicely. I want it to go down into the big vessel just above the heart, the superior vena cava.
Delivering antibiotics so close to Emilia's heart means they'll be pumped through her body more efficiently. But the PICC line needs to be precisely located.
That's a good position, isn't it? The line tip is there, so that's a perfect line tip position for our PICC line. It should last her 2 weeks, so she can get her course of antibiotics and then she can go home. So I'm pleased with that.
Exercise is vital to help clear the airways of cystic fibrosis patients.
20 and swap legs.
And a few hours after her operation, Emilia hits the gym with physiotherapist Bex.
5, 6, 7, 8. Pretty good, get out.
She was longer in theatre than I thought, but it was maybe just the time just seemed to go on and on and on. But this afternoon she's raring to go again, so happy.
When I shout frog, you jump up high.
Yeah.
And when I shout hedgehog, you bend down, touch the ground.
Yeah.
Okay? You ready?
Yeah.
Ready, go. When they're in hospital, we like them to kind of get sessions where they're working on the airway clearance and then down to the gym to get some exercise as well. Right, side stepping this time, Amelia, good girl. Especially in children with cystic fibrosis, for their lung health, their general fitness, their posture, lots of different elements. So, hedgehog. Good girl. That's it, go, 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 run, 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 run. Yes, good job.
Well done, little lady.
14-year-old Jason is recovering a day after surgery to fix his broken femur.
I think they cut about here and put the plate like here to hold it together. I'm hoping to get home because like it's just boring sitting in here and home's just much better.
Can we wiggle our toes?
But before he can get home, he must prove to physiotherapist Benita he's confident using crutches.
He's got stairs to get in the front of the house, so we obviously have to kind of make sure he can do them so he can get in the house. We kind of can't put them home until they're safe to do so.
It's for some reason really sore now.
Which, yeah, that's okay. That's all right. If you want to go non-weight, if you want to try, remember just lightly on this foot, so remember just the toes. If you hold that one there. There you go. Perfect. And remember, let this leg slide it forward. Good. Well done. A bit sorer than this morning?
Yeah.
Totally normal. Now that you're doing a bit more, it's not uncommon for things to start to get a bit sore. Is this leg sore as well?
Yeah.
Jason's left leg has soft tissue damage, and it's making it painful to walk.
Oh dear, you can't believe something as simple as that is so difficult, can you? I just think we need to give you some time just to kind of recover a wee bit, because we're only one day post-op. Okay.
Can I get some painkillers?
Yeah. Yeah, the nurse is just coming. Okay. Well done. See you tomorrow. Hope you get a bit of a better sleep tonight. Okay.
Well done.
See you later.
My left leg, the one that's not broken, because it's like swollen at the top and it's really sore whenever I stand up and walk on it, so I've not been able to do much yet, so I've not been able to do the stairs, so I've not like passed the test to leave yet.
Hopeful, yes. We won't put too much pressure on him though, he's in a lot of pain.
After a good night's rest, Jason attempts his final test. Climbing steps using crutches.
And then coming down, it's a bit different. You take your right foot forward so it's out of the way. And take the crutches in a bit closer to the step. Okay. And then push through and hop up.
I don't think I can get my leg that high.
As you hop, this will come up with it, I promise. Okay. Superb. And then take the crutches up. Just mentally preparing yourself. Just take all the time you need. Good. And then that right leg, you just out of the way and then you lower yourself down. Perfect. How did that feel?
Tiring. Can I sit down?
Of course you can. Once you've got the technique for the step, it really doesn't matter how many are in front of you when you know what to do. I think from doing those twice, I have no concerns about your technique. So I would say that you're safe on the stairs. From our point of view, you'd be safe to go home.
3 days after his quad bike accident, Jason is given the all clear to be discharged.